the composition of various and index behind. We have decided to tweak the two entities for purposes of easy coordination and the management of the response of Ebola. I want to remind you that last week the Ministry of Health wrote the information that Uganda has been affected by Ebola. And that victim, all the suspects, came from Mbale City in Nasike sub-county. The barrier was held there, and therefore that created public panic, anxiety, and people were left in suspense on how to manage. I want to thank the team from the Ministry of Health, which was able to carry that body in a manner that was befitting medically for such cases. I wish to welcome you to this meeting and thank you for coming. The reason why we called you here is because of the Ebola outbreak. We know that schools opened yesterday, and a school having population that you are having is a potential place for risk. We have so far had a number of cases being tracked right from the day when that went to Mbale. We have opened up a number of quarantine centers within Mbale City here. So far now, we have about 80 suspects in quarantine. Those who have tested positive are about 5. They are under treatment. But they are not here in Mbale. They were transported to Kampala for easy management. The situation, if we don't come together to handle it, will become ugly. Ebola is risky, Ebola is deadly. So now we are saying as Mbale State, carrying the face of Uganda in respect to Ebola now, we should see how to receive and manage information. There are some people who are moving up and down with unfounded rumors. The only authorized institution to give you the right information is the Office of RCC, the PS, and the Minister for Health or the President. Short of that, the others, we want to call it in a rare way as mere wolokoso. These children are coming from community. We need you to pay attention to how they will be while they are with you. We are saying business must continue in the city, schools must continue to operate, we must have normal business, but with precautions. Short of that, if this situation goes out of hand, you know what happened and what may happen. You know what happened in Corona and what will happen if it goes out of hand. But for now, I want to give you confidence that all the teams from the Ministry of Health are here. We have not all contacts that are in quarantine. So should we move like that? nearby health facility. Then now, the worst sign and symptom is blood oozing out from all the openings of the body. How is it transmitted? It's through physical touch, physical body contact. So I'm seeing people very anxious with masks, with words everywhere, causing panic. Ebola is not transmitted through air. It is transmitted through physical body contact. If you shake your hands, if you have the people support you. So you can mask and shake someone's hand, do not prevent you from getting Ebola, but you're just getting it instead. So this thing, father of masks now, is really not very helpful now. For now, we don't need to greet each other, we don't need to be in contact with each other, we don't need to be reckless. Let's avoid the physical contact. Social distance if possible. Don't breathe. Just say hello like we have been doing in COVID. But a mask is just something that is coming to disturb our psychology. We think that the breath is something, and yet the hand is the most vulnerable part of our body. What do we need to do? Have a must-have of the hand washing facility. All children must wash their hands whether they are coming in or getting out. Teachers must also wash hands regularly. Sanitize your hands. Ensure that you not be in a very crowded place to bring body contact. If we only did that, then we shall together fight this virus out of Uganda. Because Mbale is now controlling ultimate of Uganda. So the reason why, when I told the bank manager talking about this Mbale, going to have a serious epidemic which must control. If you don't realize that we will have to listen to the money. We first need to save our lives, save the lives of our children while at school, to stop any further decisions that will affect the learners. So the communication is
Nze bamita Hamza Banja nga nze deputy RCC Mbale City era nga ndi RCC atwala ekitundu ky'oyita Industrial City Division. Tuyisa abasomesa leero abakulira abasomesa ba head teachers mu meeting wano ku Mbale SS nga emphasis eri ku kirwadde ekyatulumba kya Ebola nga tubagamba bakipinge SOPs kubanga abamu bayinza okuba amanye abantu bali eyo nga bawulira buwulizi naye kati bano bazze n'abakugu okuva minisitule bona basomesa ntubagamba one babeere n'ebyokunaaba ku gate amazzi gagaliriyo kubanga abaana buno obutubuzi butasobola sanitizer naye abasobola sanitizer abagenze bibiina ebikulu tizoke kubanga meeting ebadde yaba head teacher bona aba primary n'aba secondary so ntubagamba babeere ne sanitizer bakipingeko ka distance kubanga buno obulwadde bukwatira mu body contact but they should not shake hands ekyo tubadde tubagamba nti tebakola ki tebakwata mu ngalo bintu bitono nnyo nga tukola ki nga tuwona tubabuulira abakugu babuulidde ne symptoms ti omuntu afuna omusujja temperature ebeera waggulu so balina okuba ne temperature gani nabo bakole ki bacekinga abaana okulaba omusujja ogwo a drop in the abalina pressure obeera neyo n'ofuna koofu n'ofuna flu so ebintu tubayigiriza era bavuddewo nga basanyufu era nafe tuli basanyufu nti bwe banaakola ebintu bino covid Ebola n'atatambula kijja tuyamba okulaba nze nti tuli safe naye nga there is no cause for alarm for now. nga bwe tugambe abasomesa ne komiti weteeka okukola banaabe mu ngalo regularly baleme kwenyiga wamu kubanga sweet eno ereeta ki body fluids ne sweet ezireeta okulaba nze nti ofuna akawuka bwe balaba omuntu alina sayinizi ezenjogeddeko waggulu badduka eri abasawo babagambe. So tewali nnyo kyamaanyi kumpi bintu nga bwe twakozesa luli edda abantu bali accustomed to it okujjako nze nti si ya mu mpewo nga covid.
So please, it's not something that we should all get worried and start worrying about it. You can prevent it, you can manage it, you can control it. But the biggest method for managing it or controlling it is prevention. The biggest you can really see within your hands is prevention. So all our efforts are prevention now, and all these messages we are hearing about prevention. So why are we focusing on schools? Of course, the Ebola is fueled by contact transmission. Contact, touching like this. And even lucky, it transmits when somebody has started what we call wet face. Like you are sweating, you are vomiting, somebody is dilating, and this sweating, like too much sweating. So when you are caring for a person like that, if you are touching, you are not protected, you are breathing, you are caring, you are feeling the heat. Some of you want to feel how hot you are. You are hot, eh? You are touching. So that is how you are likely to get a watch. But for schools, again, it's a special area because we are congested. Just one child, I don't know how many children will be in a class if one child is sick. Or in a dormitory, if a child is sick for 3 days and you are not detected, how many children will be have in a dormitory or your health facility? So that's why we are extremely very worried. So please contact and they need to educate these children to wash hands, this distance, but not to get panic, don't go back and as if there is a Ebola in the school. No. Put up measures. Like every school should have screening capacity, at least a gun. A gun for screening someone. Let's have that. Should have a nurse. We shall rush this Ebola within a month in hope and without this and leave. But at least have a nurse. Have some place where we can put a child when he's sick. We call it isolation. But hold in place. If you don't have like a nurse and what, not that medical thing at school. It's called what? Sick bed. If you don't have a sick bed, at least identify a room which is there and a child get a lot of fever, sick, is fever, there's a problem, you first put that child in that room and you call. And then the school should have gloves at least. You see, we are not asking so many things, but at least you are asking have gloves, you pick this child, you put in this room, you make a call, ambulance comes, picks the child. Don't follow the other protocol, first call the father is in the car, is calling auntie, you come to aunt is going to come, there's no transport, you are waiting. No. Call the health, the nearest facility, or our medical team should give you numbers. SHO police give you numbers, 666767, or the number directly call. And immediately the ambulance will come, you will make assessment, and they will help you identify the family, and then we solve the problem. But assess this to your kids. They can spend the whole day playing and the whole night she's going. And she's weak, she's bad, she's devastated. So please take care of that and be a partner in this fight. We are doing everything possible to support our chairperson of the task force. She has done extremely so wonderful. And we want to give her all the support so that we keep Ebola out of Mbale and we allow you to save your lives and move on properly. Thank you so much.
I'm the Commissioner for Emergency Medical Services. I come as part of the total management of the Ministry of Health. Just one is to say we are very grateful as Ministry for the leadership which is in the district and in the city and the responsiveness of the community. The most important things have been said. If Ebola is a disease that kills and moves very fast, and that is why we take it completely, we hold it with all the hands, head, with everything, all the energy you have. If you have a Ebola, you must put all the energy towards preventing that. As you all know, we are responding to many epidemics at a go. We are still having efforts going on. Even COVID-19 was not declared to have ended, so though it is mild, we still have routine diseases which manifest. But when you get Ebola, we use that Chiganda saying or saying when the big drums, then the others go silent. This Ebola is the big drum, and we must handle it with a lot of energy. And the most important thing why I really appreciate Madam RCC for mobilizing you to here, because you handle a large number of people concentrated in a small place at a go. And if we have a problem there, it becomes unmanageable. Now, the control of Ebola or prevention of it, when it has occurred, the way we got our next case, is through us reaching out to contacts. If we get all the contacts, the primary contacts, if we get all of them before they develop symptoms, you finish the disease very fast. But when he has transmitted to the next one, again you get contacts of this one. When that one, if the contacts you have quarantined, one develops again symptoms, again you have to look into the contacts of this one who has developed symptoms. That's why you see that the contact list keeps growing every day. And my appeal to you, because this, as Mbale, as a city, as a district, we are the most affected across the country. That means that we have got to be cooperative in order for us to control this. If in yourself you feel, you remember that the people they have mentioned have been in touch with them, have been in contact, as the incident commander was describing. People may not be remembering that you were also in touch, but you remember yourself. Please come out. That is the only way we can control the disease. You say yourself that before this man was taken to hospital, I visited him. We talked. think I feel I'm not safe. As the IC was telling you, if we identify a person early, first we limit transmission. Second, the chances of survival for this person who we have identified early are very high compared to the person whom we get late when symptoms have developed. The Minister of Health will be here. If you remember how we got disempowered by COVID-19, we don't want to go that path. We don't want a situation where the whole lifestyle is cut off, the whole business is cut off. No. The minister has said we must control this disease in order for us to ensure that the trade continues, people continue traveling as they want, the tourists continue coming to this country and to this region. So we must do all we can. And all depends on the people. All depends on you. When we talk about people or community, we are talking about you. What are you doing to make sure this disease doesn't go? As head teachers, as wananchi, you could be a neighbor, you could be a friend, but if you keep quiet, then you affect your family. You affect the people who have trusted you. That's why we are saying, please come out. One of the things which the IC has commented that there is some information about the treatment path, both the one of clinics, hospitals is very straight. But this one where when the patient was dilating, vomiting, where they said, wherever they took, that we have not known. Nanuwa mujanja. Wekuba kasitaba bamulira umuntu ulusanga kabagumba wamuhambako wamujanjaba umanya omuntu yali infected. At the end wiyongeye kujanjaba abantu. At the end abantu betene bikaye muntebe yes umuntu mubaye yu ikaramu. So we have got to be open, we have got to look into this thing seriously and say this, because that is the only way of controlling this disease. We must say this, and please be cooperative, be open to this person. Nobody can come here to just waste your time or to inconvenience you. No. We are coming here because there is a problem, and together we can solve this problem. It is my appeal to you that even when I was talking to the health educator of you see the risk. You also learned that he died of Ebola after we have learned about it and after we declare. You see the risk? That means culturally, when you get a phone call, if he has died from Mulago, already people are going to come, they are going to come, and when you are coming to this home, you are sitting in the chair, you are greeting, you are embracing, olikusa silamai, olikusa silabad. When you are doing that, silently, transmission is taking place. So it is my appeal that if you happen the day before we learned that this man had died of Ebola, when you heard that this man has died in Mulago, if you visited the home kusasira kwe family, it is you to say. And when
mpox is gotten from monkeys, but also Ebola can be gotten from monkeys. The next is, although mpox presents predominantly with skin rash, it also presents with the non-specific symptoms similar to Ebola. So things like malaria-like illness, cough, sometimes diarrhea, all present in Ebola. The differentiating feature is the swellings and the rash. The other thing is the prevention approaches. Mpox, you need to do hand washing with soap and water, but also to avoid contact. Even Ebola is the same thing. Again, you can also get Ebola by sexual transmission. So you see, Mpox can be transmitted sexually, so is Ebola. So in other words, you may need, when you use approaches to prevent Ebola, those same approaches would also apply to Mpox. The other approach they are using presently is vaccination. They are using vaccination to prevent Ebola, but there is also vaccination in place to prevent Mpox. So we are dealing with the same diseases. So you may wonder, why are they interested in these contacts? Why do they want them out of the community? It's because people only spread Ebola when they become symptomatic. But the challenge is, if a contact is in the community and they get symptoms, they may be in contact with other people and spread the disease. But if you've quarantined all the contacts somewhere and you are observing them every day, once they get symptoms and you test them, you've avoided them getting in contact with other people. So you can easily take them to the treatment unit and maybe increase their chances of getting saved. Okay? At the barrier of that, of the late index case, to come out. This will save their family, but also save them. Imagine for the index case, it's like the whole family is now getting symptoms. That's not a good thing. If they had come out earlier, maybe gotten the preventive vaccine, the story could have been different. Thank you so much.
For a very, very important exercise, because they are one of our very important stakeholders in disease control of this kind, for the following reasons. One, we are catering for institutions which have concentrations of people. And I mentioned Mbale, we have students which have numbers as high as 6,000, 5,000 concentrated in one place. And that concentration is a very, very big risk by itself. In case one guy catches any contagious disease, it can easily spread over to all that population. And when it gets into that population, many of them are day scholars, and they go back to the community. Then we shall be having a calamity in Mbale or a magnitude which cannot be easily managed. That's why we have to take it very, very seriously, and we have to be as attentive as possible to put in place the issues we are going to discuss collectively together today, this afternoon. Then two, we are one of the senior opinion leaders in the communities. In all the communities I've lived in, if a teacher says something, the community tends to follow. That's why you should have full information to spread to the communities you live by in the neighborhood, as well as your kids in the vicinity. So today, as the Madam Nasike said, we are here to, I don't want to say we are teaching you, but to discuss how we can collectively handle this epidemic of Ebola in Mbale city. She's already given the background. I will just little bit on a few technicalities and the SOPs you should be able to put in schools before we can open it for open discussion. But allow me, Madam Chair, Ebola, but if it is very non-specific, but if you ask somebody, you say they have been having fever for 3-4 days despite treatment and still constant, then you should be suspicious enough and link up this person. It could be a student, a teacher, or some staff to the city or district Ebola task force. Then thereafter, we shall be able to send in teams to go and assess this person and see if he qualifies, if he or she qualifies to the criteria of Ebola. Could be another illness. If it's something else, then well and good, treat and the person gets back to the community. Then 2, we should have hand washing facilities at all our points of entry. If resources are available, maybe we could even put it in front of the glass door, such that we ensure when somebody is entering the glass, he or she has washed hands. And if they have a hand, sometimes like this small one I have, well and good, because you can easily clean your hands if your hands are not visibly soiled with any other body fluid or material. Then 3, you should be able to screen these people for temperature and the other side. If somebody comes and he or she looks visibly weak, maybe pain they are having, sore throat, you should be suspicious enough. Those are some of the non-specific symptoms of Ebola, and they may look like any other disease. It may look like malaria, it may look like cough, it may look like just flu or anything else. So we should be suspicious enough and refer these people or even call on our task force members, because we have modalities of being able to reach out such people. Then when we are doing co-cultural activities at school, we should be able to observe the SOPs to a larger extent as possible. Make sure there is opportunities for washing hands as available as where they are. And don't put there just in containers, there should be water and so these are really available things in our community. So we